Hi, my name is Dr. Maria Gonzalez. I'm a dermatologist. I have actually been working in the field of dermatology for the past 21 years. Most of my career I spent at the University Hospital of Wales in Cardiff, where I split my time between academic work and clinical work. For the past 2 years, I have mainly been in private practice, but also working in the NHS for a portion of my week. My main interest is cosmetic dermatology, which includes the use of a large number of lasers, but we also are heavily involved in treating dermatological conditions, including hair loss, skin cancers, and a number of other common skin conditions that are routinely seen in private and in the NHS. I think our clinic stands out because we view aesthetic work as quite an integrated aspect of dermatological practice as well. I think it's extremely hard to divorce the two specialties, and they are quite integrally connected. For instance, if you're treating a patient with pigmentary problems, there is a diagnosis attached to that, such as melasma. If you're treating a patient with a red face, the diagnosis is likely to be rosacea. So my perspective is all our patients actually have some diagnosable skin problem, whether it is photo damage, that can be treated. And for that reason, we offer not only aesthetic solutions, but also medical and surgical solutions for all these problems. We've put a lot of effort into creating a very pleasant environment for our patients at our clinic. It's quite new, and we have tried to include cutting-edge technology, particularly in the form of lasers, for all our services. To ensure that patients get the best outcomes at our practice, we try to completely assess each patient individually. This means that we do not assume that a patient is here only for an aesthetic solution. We try to give a proper medical assessment of every patient coming in, and then we provide them with a range of options which we think are best suited to their particular issues. I believe the involvement of our dermatological skills is particularly essential in delivering this sort of outcomes for our patients.
She's a beautiful person, Dr. Gonzalez is. She knows her stuff. She makes you feel comfortable. You know you're in safe hands. And for something like your face, because I was so depressed anyway, the last thing I wanted to do was to go to some beautician or some salon that just done laser treatment and really only had like a half-hour course on it. So the way forward is with a qualified dermatologist that knows what she's on about.
The specialist skin clinic sees quite a wide range of patients. In fact, we treat patients as young as 10 years old here who may have conditions such as port wine stains or spider nevi. We also see patients as old as 80 years old. So all patients are welcome, and we try to provide a service that suits all age groups of patients and specific to the conditions that you see in these different age groups. We're particularly keen to point out that we have a special interest in managing patients with pigmented skin. For those of you with pigmented skin, you probably know it's quite a difficult area to treat without problems and complications, and we have a special interest in ensuring that these patients get the best possible outcomes from all our treatments.